Hi everyone, it's Indy Lane with the Fishers Health Department. October is Breast Cancer Awareness Month. Since many of us had to postpone our routine screening due to closures of provider offices, this is an excellent time to remind women about the importance of breast cancer screening with mammography. In the United States, a woman's lifetime risk of developing breast cancer is approximately 1 in 8, or 12%. While no one ever wants to have a cancer diagnosis, the good news is with early detection, improved breast cancer imaging, and more effective treatment options, the current 5-year survival rate for breast cancer is 90%. Women at average risk for breast cancer should have a mammogram every year starting at age 40. Women with a family history of breast, ovarian, colon, prostate, and/or pancreatic cancer in first and second degree relatives should discuss whether they are at increased risk for breast cancer with their healthcare providers. Keep in mind there are other important factors related to family history, such as age at diagnosis. A good example is breast cancer diagnosed in a mother, sister, or grandmother before the age of 30. This may warrant more consideration than the aunt with a diagnosis of breast cancer at age 65. These days, there are a number of easy and affordable genetic screening options for women who may be at increased risk. Please remember, the vast majority of women who are diagnosed with breast cancer do not have a significant family history. So let's take some time to discuss some of the risk factors for breast cancer. Age. We know breast cancer risk increases with age. Being female, breast cancer occurs 100 times more often in women compared to men. Men, however, can develop breast cancer too, and there are 3,000 cases of male breast cancer annually. While breast cancer remains the most common cancer among women of all ethnic groups, in the United States, white women have the highest rate of breast cancer. Despite this, Black women often present with more advanced disease at the time of diagnosis and are more likely to die of breast cancer-related disease compared to their white counterparts. Increased weight and body fat, particularly in postmenopausal women, seems to also increase your risk of breast cancer. Age of first menstrual period and/or age of menopause can play a role. First pregnancy later in life, no history of breastfeeding, breast biopsies with atypical hyperplasia or lobular carcinoma in situ increased risk. Certain ethnicities have a higher risk of the BRCA mutation, such as Ashkenazi Jewish women. Alcohol consumption, menopausal hormone replacement is somewhat controversial, and the risk depends on the duration and the type of hormone replacement. Discuss your menopausal symptoms, risk factors, and the risk of hormone replacement with your healthcare provider. We know smoking, dense breast mammography, and prior exposure to high-dose chest irradiation in young women may also be risk factors to developing breast cancer. Like so many health challenges, prevention and early detection are critical. There are definitely risk factors we cannot modify, such as our gender, our age, or our genetic history. However, we can make lifestyle changes to decrease our risk. Focus on regular exercise, a diet composed of fresh vegetables and fruits and lean meats, and weight management is extremely important. Do not smoke and limit alcohol consumption as well. In addition, women at average risk for breast cancer should have breast cancer screening every year starting at age 40 with a mammogram. If you're not old enough to begin breast cancer screening, please remind the important women in your life to get their mammogram. This year has certainly been unusual, and I feel compelled to remind everyone to continue to see their provider on a regular basis for routine health maintenance. We must remain vigilant with respect to preventing the spread of COVID, but please do not ignore worrisome health symptoms such as chest pain, muscle weakness, severe headaches, skin changes, changes in bowel habits, and changes in the skin or breast tissue. Your provider's office have implemented a number of safety measures to keep you and your family safe from COVID. Please do not avoid the office or the doctor's office or the hospital for fear of COVID. Please get your preventative health maintenance done this year and every year. Thank you.